Hello, my name is Elena, and today I will be doing or showing you all a head-to-toe assessment. I have my patient here. Her name is Anna Johnson, and her birthday is April 1st, 1995. So the first thing that what I would do when I would come in the room is I would go ahead and perform hand hygiene, introduce myself to the patient, that I am the nurse, Elena, and we will be doing a head-to-toe assessment. I would ask the patient what her name and birthday is to verify. She said Anna Johnson, and again, the birthday is April 1st, 1995. And also, while she's doing that, we can just look at her wristband, if they have one, just to verify. We'll go ahead and give the patient some privacy. Pull back the curtain. And then before we get started with the actual head-to-toe assessment, Ms. Anna, I'm going to go ahead and ask you a few questions. The questions we would ask her would be, you could ask her what's pertaining to her medical history, like does she have any major medical problems, does she have any history of surgeries, is she currently on any medications, does she have any allergies to anything. We would ask her if she's had a flu shot, an up-to-date flu shot. If she was over 50, we would ask her if she's had a pneumonia shot. If she is not, we would ask her if she uses any type of mobility devices, such as a cane, crutch, walker, wheelchair, crutches, anything like that. We would ask her, is there a special diet she follows? We would go ahead and test the level of consciousness, and that's when we ask questions like who is the president of the United States, what day of the week it is, where we're currently at. If they answer all three of those correct, we would say that they are alert and oriented times 3. And if they're not, while they're saying it, you could say that their mood is pleasant as well. And just by looking at her posture, she is laying down. So for someone who's laying down, her posture is normal. By looking at her face is nice and symmetric. Again, by looking at her breathing does seem to be at a normal pattern. So those are the key questions that we would ask beforehand. Now, the actual assessment. We'll go ahead and start with the vital signs. Got the blood pressure cuff. We're going to put the blood pressure cuff on. And while we're checking the blood pressure, we could go ahead, if we're using a machine, we could go ahead and look at our pulse rate and stuff, but we're doing it manually, so we can only focus on this. But a regular blood pressure blood pressure reading is 90/60 over 120/80. And then we can go ahead and do her pulse. We go ahead and do the radial pulse. And then a normal radial pulse is between 60 to 100. And while we're looking at her pulse rate, we can go ahead and look at her respiration rate. And that is normally between 12 and 20. And also when we're looking at her fingers, we can go ahead and check for signs of clubbing, which is when the nail bed is larger than normal, which could indicate a respiratory illness. We could also check for cap refill. You press on the finger and wait for the blood to return. The normal cap refill is less than 3 seconds. So all that came out normal with the vital signs. So as far as the first step in the head to toe, we're going to start with the head. I'm going to go ahead and inspect her cranium for any signs of a mass or lesions. And we can go ahead and look at her ears, check for any signs of a blockage on the outside. And she does not wear any hearing aids. If we had a scope that we could look into the ear, we can look inside and check for signs of a blockage to see if we can see the eardrum. And we can go ahead to her, palpate her sinuses. And I can go ahead and look at her eyes. She does not wear any type of glasses. You can pull down her lids and look, make sure that her conjunctiva is all pink and moist. There's no discoloration there. Alright, we can go ahead and get her to look over her mouth. We look at the mucous membranes, looking at the tongue, looking at the cheeks, looking at the throat. Also look at her nose, make sure there's not any abnormalities there. We go ahead and look for perla, which is when we're looking for our pupils to dilate. Good. We can also do the 6 cardinal gaze. We would take our finger and tell the patient to just follow the finger. This may look a little funny. And you would do it 6 times, and again, the patient would just follow your finger whichever way you're doing it. So what I'm going to ask her to do, what I could ask her to do next is just some facial expressions. Looking at her face, it is nice and symmetric. But to look at the actual facial expressions, we could ask them to puff out their cheeks, smile, make a frown, and raise their eyebrows, and stick out their tongue. So that's how we look for facial expressions. And now we can go ahead and move to the neck. Look for any signs of a mass or lesion. Go ahead and palpate the carotid arteries one at a time. Go ahead and take a pen light. And look for signs of JVD, which is jugular venous distension. She has no signs of JVD. Go ahead and move to our chest, looking for any signs of mass or lesions. Looking for skin turgor. If the skin turgor is poor, which is when the skin does not automatically retract after being pinched, that could be a sign of dehydration. And go ahead and listen to her lungs and heart. With the lungs, we want to make sure that we're hitting at least 6 on the front and 6 on the back. So we're listening to the lungs. Also take the lungs. And we're just going to flip this over, pretend this is a bat. Okay. And while I have my stethoscope in, I'm going to go ahead and listen to her heart as well. Heart and lungs sound normal. Going back to the respiratory rate, I'm looking to make sure that her breathing is unlabored, which it is. And then her respiration rate is at a regular rate as well. And she's not using any type of accessory muscles, which is what unlabored means. Looking at her chest, it is nice and symmetrical as well. No signs of a barrel-shaped chest. So before we go down to the stomach, what I would do is go ahead and feel her arms on both sides at the same time, just looking for symmetry with her muscle tone. Then we can go ahead and check range of motion as well and muscle strength. So to start with the range of motion with the neck area, we would ask them to move her head side to side, and then up and down, and then shrug their shoulders. And check range of motion. This about 5 times. So do this about 5 times. Wiggle their fingers for a little bit. And then to check for strength, we can ask the patient to do this kind of maneuver. And then as the healthcare provider, you would go ahead and just place or rest your hand on this area, and you would instruct the patient to not let you pull down, and that's a good test for muscle strength. So now that we've done that, we can go ahead and go to the abdomen. When we're down here at the abdomen, the first thing we want to look for is symmetry. Just making sure that the abdomen is nice and symmetrical, which it is. We're going to look for the umbilicus. Scanning over her abdomen, there's no signs of mass or lesion. First thing we're going to do is listen to her abdomen before we palpate, starting with the right lower quadrant. So we're looking for bowel sounds, making sure that her bowel sounds are nice and active. We would ask her when was her last bowel movement. We would ask her when was the last time she's urinated and the last time that she ate something. And we can go ahead and palpate her abdomen now. And while we're doing that, we would ask the patient, does she have any signs of tenderness or pain? If there's no pain, that's good. So now that we've done that, we would go down to the lower extremities, which is the legs. When we're looking at the legs, again, you would go ahead and feel both sides like you did with the arms, just looking for symmetric muscle tone. When you're actually inspecting the legs, you would look for any like shininess or discoloration. You would look for any signs of edema or swelling. And then you could go ahead and look at the toes. With each feet, look between each pair of toes for any type of skin breakdown. And then you could go ahead and look at their pulses. The popliteal pulse is normally located behind the knee, the back. You could go ahead and do the dorsalis pedis, both of them, and those are usually on top of the foot. And then the posterior tibia, those are done in between the ankles. So yeah, you would check those. And you would also check for range of motion in the hip area. You would check for range of motion in the lower legs. You would check for range of motion in the knees. You could also check for range of motion in the ankles and the feet. And you would also check for muscle strength in those areas as well. So once you've done that, that pretty much concludes the head-to assessment. At some point, you can observe the patient's gait to make sure that they're walking normal. You could ask them to do 6 steps one way, and then just ask them to do 6 steps the other way, making sure that their gait is normal again. So yeah, so that concludes the head-to assessment. Thanks.